So the first one in your paper is temporality. What does that mean, and what did you find?
Well, temporality would mean how does it work over time? And I've made some notes to get it to
Please do.
easily. Yeah. So it's clearly we have been able to show that ivermectin would satisfy temporality because you see this jump. In the same time, with those two particularly aggressive regimens, both in the same time push up the blood oxygenation. So that's temporality.
The effect is following the cause.
Absolutely.
They're in the right order. Yeah.
Exactly. So I just also want to mention to you that the Bradford Hill criteria of 1965 included 9 criteria.
Yeah.
And like a lot of people who like rules to think, they created a tick box system.
Yeah.
And so, which is not what Bradford Hill intended. What Bradford Hill intended was to look at an argument from all these different angles and come up with what he called an inference to best explanation.
Yeah.
And also in the 1960s, if you cast your mind back, there weren't many RCTs around.
You can't remember the 60s, Colleen.
I was born then.
Yeah.
But there weren't any randomized controls. So people were trying to make sense of how can we infer an explanation. And so to modernize these, a lot of people have criticized Bradford Hill. Howick and his group in 2009 took those criteria and have modernized them a bit. So they do include randomized control trials, which were not included in the beginning. So they do fit here. But temporality is common across both of them. And that is, we actually do see these things happening in completely different experiments. Well, they're not experiments, in completely different studies.
Clinical situations. Yeah.
Yeah, that at the time that the data was being collected, Hazan, Stone, Babalola didn't know each other. We all got together a bit later, and we've now become friends internationally. But that shows your temporality. It definitely did work, and we showed this. We showed this particular graph in the Zimbabwe paper, the Stone paper that we discussed a good few years ago now.
And of course,
we were able to show.
Sorry. No, go ahead, Colleen. Sorry.
So scientifically, one of the tenets of good science is to be able to have repeatability.
Yep.
And these 3 studies actually show that. They had slightly different approaches, but they all showed that it was with ivermectin that you could improve blood saturation.
And it's not just these 3 studies. I mean, I talked to Dr. Pierre Corey.
Yeah.
Way back in, I can't remember. I think it was 2020, actually. He'd done a deputation before, I can't remember if it was Congress or Senate, on steroids, and that was accepted. Then he did another one on ivermectin, and that was not accepted. And it had 10 million views on YouTube in about a couple of days, and then it was taken down. So it's doctors around the world who, if you like, were flying by the seat of their pants in 2020, just looking for ways to suit their sick patients. Found ivermectin worked, but this war on ivermectin seemed to crop up, almost, a cynic might say, in a coordinated way around the world.
I find it, the cynical side of me, just to address that, is we now post-COVID.
Yeah.
And people are acknowledging it was a lab leak. There is just no other explanation.
The debate is basically over, isn't it? I mean,
yeah. And people like you and I who mentioned this in 2022 when we first met.
I think 2021 I was getting pretty suspicious about it.
Yeah. We were saying it very quietly because we said it out loud. We were accused of being kooks.
Yeah.
And whenever I did say it out loud, I was shouted down. So the lab leak theory is out there.
Yeah.
I think we also started talking about serious adverse events with the vaccine a few years ago. And again, we were doing it very quietly. I very subtly left a position of power I was in because I felt very uncomfortable. And I didn't want to be truthful about it because I'd have been told that I was a kook. But now people are accepting, yes, we've got serious adverse events. But what has not reached the Trusted News Initiative, which includes lots of newspapers and television stations around the world, is the fact that we had very good drugs that were repurposed, that worked, and they were squashed. And they were squashed because other companies wanted to try out their new things. So,
or again, a cynic might say they wanted to make some money. Who could possibly know?
Oh, well, for people like you and I, where money isn't important, that's the first thing we think about.
Well, it's handy to be able to pay for your groceries, but yeah, I'm sure we could both make a heck of a lot more money than we do. Right, let's move on to the. I know you could. You're an internationally renowned professor. You could certainly make a lot more than you do. No, you are. People don't realise professors are remarkably senior. Well, it is the most senior academic grade, isn't it? It's not. I was never a professor. I never got past senior lecturer. I was just a minion. Professors
I
were
was a minion until about.
Professors were kind of up there to me.
But it doesn't mean we are internationally renowned.
No, but you happen to be
controversial.
I know we did a couple of gigs together in Sydney, so
yeah.
at least we're known to some extent in Australia.
Yeah.
Now, next criteria, the strength of association. This is kind of an effect size, isn't it? What were you thinking about the strength of association?
So for strength of association, you have to start looking at maths. And so the reason for the two-part series is part one is establishing that strength of association. And that's where Eleftherios is an absolute genius when it comes to looking at a problem and coming up with a mathematical solution to it. So I first met Eleftherios, who's the first author on both of these papers, when he approached Dr. Zelenko several years ago now, when Dr. Zelenko was putting out his protocol where he got very good results in New York with hydroxychloroquine. I think it was still in Trump's first term. And that is why Trump was saying we're going to use hydroxychloroquine.
Well, he took it himself for a period of time.
Yeah. And Eleftherios then wrote up a method where you could compare multi-drug treatments to be able to come up with a mathematical evidence that this is truth.
Yeah.
As opposed to doing a single drug randomized control trial. Because let's face it, when you're in a pandemic, you've got sick people in front of you. You're not going to get away with just one drug, with a monotherapy. I mean, every single illness is treated with a cocktail because there are lots of different aspects of the disease that need to be treated. So Eleftherios had written this paper with Dr. Zelenko showing mathematically that you can compare multi-drug treatment protocols. And so what he did for our paper in part one is he looked at the three studies, the Hazan, Stone, and Babalola papers, and used ordinary maths to show that it's almost impossible that the results for our two criteria were mortality or admission to hospital. It's just about impossible that it wasn't ivermectin that caused people to not go to hospital and not to die. So the strength of association is worked out in paper one, and that's a mathematical paper that I'm very proud to have my name on. It is written by a professor of mathematics, so it is pretty comprehensive. And it's been downloaded. Luckily, part one has been downloaded a lot of times. So I'm thinking a lot of people are beginning to see that we can use other kinds of maths. It doesn't have to be a randomized control trial with a p-value. And we'll get to the p-value a bit later. So What he was able to show mathematically is that we have got a strength of association here. It's definitely ivermectin that prevented these patients from serious hospitalization or from dying.
Yep.
So we have that factor satisfied now.
Well, I've got two ticks so far. Yep.
Yeah. He explains this as it's not causation, it's inference to best explanation by saying, for example, you go to the movies and you eat popcorn at the movies and you come out of the movies at the end and somebody hits you over the head with a baseball bat and you end up in the A&E. What is the likely cause of your injury? Is it the popcorn that popped so much that you fell on the ground? Is it the movie? Or is it the baseball bat? And you can make a decision that it's a baseball bat, probably because you've seen previous baseball bat injuries. You've not seen any injuries like that resulting from popcorn, etc. So that is what we're looking for.
Yeah.
It's not saying it's a perfect causation, but it's the best explanation. You know? It's using scientific and human logic.
It's almost like an Occam's razor sort of thing, isn't it?
Yes, it's exactly that. Yeah.
Good. Now, the next thing in your paper is biological gradient. What is a biological gradient?
Well, if you have a look at this diagram that you've got here, Sabine
this one.
and
This one.
Yeah. Sabine and Jackie used a lot of ivermectin. They used high doses of ivermectin. And Babalola used a lower dose for less time. So you can actually see less ivermectin, slower progress, big bolus of ivermectin, quick progress.
Interesting.
And that would be your biological gradient. Interesting and very sad anecdote is I know of a patient, an elderly woman who was hospitalized, and her family managed to find 3 ivermectin tablets for her that they smuggled in. And she was, after her first one, she was able to breathe. After the second one, she felt fantastic. After the third one, she said she's now ready. She's feeling great, but they still kept her in hospital because she was pretty advanced. She was still in the cytokine storm.
Yeah.
And she
just 12 milligram tablets of ivermectin.
Yeah. But it was at a period where people still didn't know about dosages. They were still scared of liver issues, and so she couldn't get any more ivermectin, and she just dived and died. So that to me also shows it's anecdotal. It'll never be written up because it'd be too much trouble around it. But to me, that also is a biological gradient. You withdraw treatment and the patient dies.
Well, and it fits in with the temporality as well, doesn't it? She took the ivermectin, she felt better. She stopped the ivermectin while the infection was still raging, and it's very, very sad story. Right, mechanistic evidence. What is that?
Okay, this is a lot of fun because in the ivermectin wheel, we could show a lot of laboratory studies. So there is a lot of mechanistic evidence that ivermectin has got various different mechanisms of action, and these are published. So if we move on to that diagram on therapeutic response,
the word is plausible, isn't it? There's plausibility here.
Yes.
It's not like giving something silly or a homeopathic preparation. There's actually a way that this could work.
Yes. Yeah. So if you have a look at the progression of the disease, now this diagram comes from McGonigal et al. Originally, there is this viral infection, and then it proliferates.
Yep.
And if it's not treated early, this is why people like Jackie were pushing for early treatment. That would have prevented going into that cytokine storm.
Mm-hmm.
If the cytokine storm is not controlled, then also while you've got the cytokine storm going, you've got this thrombosis going on. And ultimately that leads to death. because you've got these microclots that are whizzing around the body,
Yeah.
causing all sorts of organ damage, and end up with death if your body is not able to fight that.
And of course, particularly in the capillaries in the lungs, because they're some of the smallest capillaries in
Yes.
the body. So
They're
anything
so
that's going
small
to,
that only single red blood cells can get through them. Yeah.
in fact, it's even more than that. They have to squeeze down to get through. So, the red cell's about 7 micrometers in diameter, and they actually squeeze down to about half that to get through. You can actually see them deforming to get through the pulmonary capillaries.
So if we look at this diagram here, there's evidence that ivermectin can prevent viral proliferation. It says a zinc ionophore, and if it allows zinc into the cells, it's going to prevent the proliferation. It has an anti-inflammatory impact in the cytokine storm.
Yeah.
And then there was this very elegant experiment done on the thrombosis. So Boshi and his group took petri dishes and infected them with the various COVIDs. And with blood, so he put blood in the petri dish and then infected them, and he got this micro thrombotic effect. He then put ivermectin and other drugs, I think, were also in it, but ivermectin into all these plates, and that resolved. If there was ivermectin on the tray and the blood was then added, and then the virus, there was no microagglutination. So they showed that ivermectin prevented that microagglutination.
Yeah.
And how David Scheim has explained that is that these spike proteins are free in the blood system, and they are attracted to the red blood cells. So the red blood cells start looking like they've got Velcro around them from spike proteins, and so they start sticking to each other.
Gumming up with sticky spike protein.
Yeah, so they start sticking to each other, and when they stick to each other, they make these microclots.
Yeah.
Which means when they've got a microclot, it's going to block up your blood vessels.
Yeah.
So your red blood cells are no longer able to get oxygen to the rest of your system. So not only are your clots causing havoc in the rest of your blood, in the rest of your body, you've got these clots in your lungs that can't get oxygen, can't release their carbon dioxide and get their oxygen. Ivermectin comes along and it competes for those spike proteins, and it resolves. It takes those spike proteins off the red blood cells, and that explains why the patient feels better. So they've got
we'd call it a competitive inhibition, wouldn't we?
Yes.
So the ivermectin is competing with the red cells to bind the spike protein. The ivermectin has got very
effectively.
The ivermectin's got a higher affinity for the spike protein than the red blood cells. Yeah. So the spike protein binds to the ivermectin, not the red blood cells, meaning that the red blood cells are free to become individual cells again and perfuse the pulmonary capillaries. It makes perfect sense, as does the anti-inflammatory.
Yeah. Let us just digress for a moment here. So now we know, and we knew quite a while ago, that it's the spike protein that is gluing the red blood cells together.
Yep.
So you and I are tasked with creating a vaccine. Are we going to sit down and design a vaccine that makes your body create lots more spike protein? Maybe we should leave it there.
Let me think about that one just a minute. No, the answer is, I mean, how could they have got it so wrong? Let's design a vaccine.
Yeah.
That causes the body to produce the most toxic part of the virus. It just doesn't make any sense.
Give them their due. They probably didn't know that. But then as soon as the evidence was coming through, they should have.
Coronaviruses have been around for a while. And, there's lots of other proteins in the virus that they could have, lots of other epitopes they could have attacked. It really is quite bizarre. But the other mechanism I like there is the zinc ionophore. So what's happening there is zinc, when zinc is inside the cell. So viruses, of course, are what we call obligate intracellular parasites. They get into the cell, they're working inside the cell, they're replicating inside the individual cell. But zinc can kill viruses, or zinc is antiviral. So if we can get more zinc from the outside into the cell, it's going to have an anti-viral effect. And we know that ivermectin will open up the doors, what we call the zinc ionophores. So a 4 is a channel, an ion is the zinc. It gets into the cell. It mediates the zinc through this phospholipid bilayer cell membrane, which is normally impervious to. Gets it into the cell, then the zinc does its stuff and gets rid of the virus. I mean, all these mechanisms just make perfect physiological pharmacodynamic sense. They sound really quite plausible.
Exactly. So if we had early treatment for everybody, then we wouldn't have got to need the cytokine storm issue.
Yeah.
And
I think that's the key thing. The key thing here is these antiviral treatments need to be given early.
Yes.
To stop the viral count going up, causing the complications. If the viral load can be controlled at an early stage, then basically the whole disease is aborted. It's terminated.
Well, that explains why prophylaxis worked. Yes. In those countries that had ivermectin prophylaxis, that's explained. This diagram also explains why high doses of ivermectin in the thrombotic phase are important. Because by the time the patients are not able to breathe, they have got to the thrombosis phase.
Yep.
So low doses of ivermectin right in the beginning to prevent progression of disease or disease at all
is ideal.
And higher doses later to zap those clots, get those red blood cells freed up, get the oxygen through, break the clots in the alveoli, etc.
So the earlier in the evolution of the disease that you give the ivermectin, the lower doses will be efficacious.
I would think so.
In later
I haven't come across many of those trials, but the fact that we had prophylaxis trials, that indicates that to me.
Yeah, but to break up if you are in the thrombotic stage, you'll need much higher doses of ivermectin to be.
Yeah, and that's what Sabine Hazan and Jackie Stone showed that.
Yeah.
In the 2 studies we've used, yeah.
Okay, so I've ticked mechanistic evidence and biological plausibility. Is there any other components to look at under mechanistic evidence, or is that the basics of that done?
I think we've gone. The coherence is looking at the fact that we can show the Boshi study how and we really wanted to do an experiment where we could look at the blood flow through the fingers of patients and have a look at how it changed with ivermectin. But we drew up that study when Omicron came out. So there were no longer patients going to a hospital, so we couldn't do the study anymore. Yeah. But that would have been something really good to show with the coherence as well.
Mm-hmm. Did you just unpack that coherence idea a bit, Colleen? I mean, what do we really mean? What did Bradford Hill mean by coherence?
Well, I think coherence comes more in. Let me just find my notes.
Mm. Basically, is there consistency between epidemiological findings and laboratory findings and clinical findings? It's how how internal validity really, isn't it?
So we've got consistency at viral proliferation level with Cayley's study, that very first one that came out in April 2020 from Australia. So there's that study that showed when she put out all her petri dishes with COVID and treated all of them with different repurposed drugs, ivermectin just killed the COVID.
Yeah.
So there's that lab study that looks at that mechanism. And then the thrombosis study was that study that Boshi et al. Did.
But we've got coherence between communities that used ivermectin, individual bench science on the plausibility, the mechanisms, tied in with the clinical effects that people like Jackie Stone were seeing. So we've got coherence between these three lines of evidence, what you might call the biochemical bench evidence, the bedside evidence, the clinical evidence, and then the whole community level of evidence. We've got coherence between these three epistemological ways of analysing the problem, really. So again,
and that is where the wheel would come in, because in one picture of the wheel, you could actually see the coherence. You can see how much is being done in the lab, how much has been done clinically. And the wheel did show a lot was done in observational trials, and it was mostly positive, showing that ivermectin was working. A lot was done in the labs, also showing that how they could explain why it was working in the clinic. There weren't many randomized control trials, because who does a randomized control trial within 2 to 3 months of a pandemic being announced? It's just not feasible. And I think it's inappropriate for randomized controlled trials to be called for, especially with a single therapeutic in a pandemic situation. We're not automatons. We are looking at human beings.
Yeah, I mean, to do a randomized controlled trial there, not only was it never going to happen because there's no money in it, it also, had it happened for a drug with the efficacy of ivermectin, it would have been completely unethical to have a placebo group.
Well, that is exactly what Tess Laurie said.
Yeah, because they would simply have died. If Jackie had divided her patients into ivermectin group and placebo group, then, well, it would be unconscionable for a clinician to do that.
Exactly.